Hi everyone, I'm Dr. Susan Blum, founder and director of Blum Center for Health, and I'm so glad to have you with me today. I'm thrilled to introduce you all to Dr. Stephan Quentzel, our newest doctor at Blum Center. He's an integrative psychiatrist, and I can't tell you how excited I am to have your services here, because integrative psychiatry, and you're going to all learn exactly what it is, because a lot of you probably don't realize that there's so many options to taking medication, and there's so many things that you can do to help treat and address mood and all sorts of other issues. And Blum Center for Health, as you all know, is an integrative and functional medicine center where we treat the root cause of illness, and we look for other ways to do things that bring in, approaching the whole body, right? The whole system. And so having someone who approaches psychiatry that way is such a great fit for us. And Dr. Quinzel, who's going to tell you all about himself, has been practicing this way for many, many years. So he's a seasoned, experienced professional, and he's joining us here part-time to offer services to our community. So I want to welcome Dr. Quinzel, and so maybe you can start out by telling everybody a little bit about yourself.
Terrific, it's a pleasure. First of all, thank you for having me. I'm excited to be here, and to spread the good news is a joy.
Yes.
And doing this work is a joy. There's not that many opportunities to really sort of make a living helping people, and I really find it rewarding. So more opportunities to do it, not just New York City, but here.
Yes.
Wonderful.
Yeah.
And it really is as rewarding for me as I hope it is for patients.
Yes.
Holistic psychiatry, interestingly, is really just good psychiatry.
Right.
It's a shame, and you could say that about internal medicine, or practically any field of medicine.
Yeah.
And in some ways, the medical model stops with taking away the bad, but there's so much room to put in the good, and so really trying to work on a full spectrum. So is it someone who's really suffering with a great deal of symptoms and pathology, and we need to sort of, in a sense, take away the bad, try to treat the problem, but then not stop at sort of neutral, and neutral isn't all that great anyway.
Right. So what do you mean by take away the bad?
Well, we'll
What do you
find,
mean by that?
good point, we'll figure that out. There's so many ways to try to treat, ideally drawing upon your own powers, your own inert powers, and your own innate powers of healing.
Yes.
But marshaled in so many ways. In some senses, everything is cellular, but everything is not just cellular.
Meaning everything, when you say cellular, you mean like physical, biochemical?
At some point, every thought, every feeling, every behavior has a cellular or biochemical component.
Right.
And it's just that we can get at that in all sorts of ways. So everything does have a cellular quality or a biochemical underpinning, but that's not to take away the magic.
Right.
We're not just a collection of carbon-based
Biochemistry.
right. And so we can come at affecting ultimately what's happening physiologically in many ways, most of which are indirect. And that's really, when I say good psychiatry, that's what we wanted to get at with psychiatry all along. And we can. So it's almost returning to a blank slate and say, wait a second, what could we do in all the ways to not just affect brain health, but the expressions of brain function, which takes on spiritual qualities and cerebral and clearly thought, emotion, art, expression and creativity, all a part that make us tick. There's a little cell firing with every creative imagination we have, but we're not just cellular. And so this notion of sort of biological psychiatry, which is interesting and does speak to the advancements we're making in brain science.
And that's where the medication comes in, right? It's mostly
but
the
so does the love.
Yeah.
And that has chemistry.
Yeah.
And so does the creativity. That has chemistry.
Right.
And the relationship in the room. There's so much happening that we want to utilize. And all the ways we can get you to go out there and pursue optimal, not just good enough.
Right.
And it all translates into biochemical terms, but not just biochemical terms. And so it's kind of reductionist to think that we're going to find magic in sort of direct manipulation only, when we have so many ways that we can affect, in essence, the cell in the magical and desirable ways that we've marshaled for thousands of years, but we still do it now. And it also is realistic because we need to treat now. And so we look to the future with all sorts of fascinating ways that we're going to have direct effects on genetics and brain function. But more of that is wishful thinking at this point than direct thinking, direct application. We can do a lot, but psychiatry is, unfortunately, still rather primitive.
Right, so if we can, let's just back up for a second and say, my understanding of conventional psychiatry is that it is very linear, right? It's like, a disease model. Figure out what disease you have and then give you a medicine for it. It's sort of like the same how I talk about conventional medicine in general too. It's a very disease-oriented model, and really psychiatrists know what to give you after they figure out what you have, right? And that helps determine the medication. And so medication, although isn't it true, actually just jumped into my head, isn't it true that we don't really even know how some of the medications work? Like SSRIs, right? Like they don't even really know what's making the effect.
Psychiatry, it's not a condemnation, but psychiatry is primitive. Not only do we not understand how the medicines work, but we don't understand what the illness is. Right. You get in trouble if you do a brain biopsy on live people.
Right, you can't do that.
And we don't have a good system for reducing it. Brain scans and genetic tests and things, they reflect on things that are happening, but they don't give us the kind of pinpoint understanding about how we generate change. Psychiatry is more like indigenous medicine, actually, than it is maybe like oncology, where you look at the nature of the cell and try to diagnose and treat at that level. Really, if you look at sort of 1,000 years of some indigenous people who've noticed over time, if you have this rash, we don't know why you have it, but this berry seems to help it.
Right.
But that berry doesn't. But that berry helps a different rash. And we've accumulated this empiric knowledge over 1,000 years, or 2,000 or 5,000 in indigenous work. That's basically psychiatry at its most cutting edge in a biological sense. We don't know why you have the illness. You have a psycho rash that we really cannot define.
Right.
And we have a psycho berry, a pharmaceutical berry.
That's a great analogy.
That we rub on it. We can't tell you why you have the rash.
Right.
We can't, the psycho rash in the sense, the psychiatric illness. When push comes to shove, we have simplistic models, but not really, and they're certainly not diagnostic.
Right, and it seems that there was ways that everyone thought it was working, and now we're finding out that wasn't really like
Exactly.
This new research on the SSRIs, which for those of you listening, SSRIs are selective serotonin reuptake inhibitors, the classic thing that's given to people for treating depression. So in terms of backing up and being a little more concrete for everybody, so that I found that really helpful just to understand that instead of like a disease model and you're just trying to treat the disease with a medication, there's so many other ways. And what I also love what you said was you actually do change biochemistry by working with mind-body medicine, by working with spirituality, by working with nutrition and all the different things that you do.
Absolutely.
And relationships and like those things, sometimes people think of the word psychosomatic and they say, I think it's all, but actually, and I don't know why I even mentioned that word, it has nothing to do with psychiatry per se, but what it struck me is that sometimes that those things actually do translate to biochemistry.
Oh, yeah.
Like when people think, oh, it's in your head, I tell my patients, okay, so it might be something that is in your emotions or your mood, but that actually is doing something.
Yeah,
right?
and great.
And
it gives
great.
us opportunity to
Right.
move forward.
So you actually can change biochemistry with all these other ways. You don't have to just do medication. So that's great news for everybody listening, right? Because you don't only need to do medication, but you're not anti-medication though, because I know you work with.
No, absolutely. There's too many people who are so grateful that they have medicines that make a real difference. And we would say the same thing about so many other areas of medicine.
That's right.
To talk in holistic terms is not to dismiss any facet of what we can do within the limits of what we know. But we can draw on the riches of science, the wealth of tradition, and draw on all of it. Yeah. We don't have to segment.
Integrate.
Yes. Yeah. And we also, that's in terms of tradition and sort of hard science, but it's also from the tips of your toes to the top of your head.
The whole body.
It's it's intuitive that emotions speak to the body. It's used as an insult too often. It's all in your head.
Right, that's what I was trying to get
But
at before.
But yes, it's all in your head. Great. That's not an insult. That's a positive.
Right.
Great.
Right.
Emotion is there, and creativity and problems and things we wrestle with, and what you feel in the tips of your toes is because of what's happening in your head.
Yeah.
And the way your gut
And it's
is
real. It's actually is really doing something to your toes. Yes, that's what I was trying to
Or
make
people
point.
dismiss they say it's placebo. Great.
Yeah.
What a great thing.
You're actually doing
non-toxic
something. Right.
treatment.
Yeah.
There's actual connection between what you're feeling and the rest of your body and your head. It's the central control room for whatever's happening around your body. And of course, they're going to be just intricately connected, inseparably connected. It's so arbitrary to sort of say, well, there's one specialist from the ears up kind of thing, and another specialist from the ears down or something like that. They go together so inseparably, and that's terrific that we can tap into that. It's not a weakness or it's something to dismiss.
It's an add-on.
It's a fantastic add-on. What a wonderful thing that you can feel better by making art.
Yeah.
Or by loving your neighbor.
Yeah.
Or by the nutritional attention that you pay to yourself.
Yeah.
Or how you pump blood and nutrients to your head with exercise. Or the wonders of meditation. And the brilliance that we can do with certain pharmaceuticals to make a real difference.
Right.
And who
because
am I?
People too get nervous that they come to see someone like you and someone like me, and we're going to say no more meds for you, right? And other doctors sometimes get nervous sending us people because they think we're going to mess with their patient's medication. And well, that's probably more speaking towards what I do as a generalist, because for you actually you are doing traditional psychiatry too, in the way that you're a pharmacologist. You understand about medication and actually, so maybe you can speak to that for everybody, because people get nervous about how you work with meds. And it's one of the things I'm really grateful about your skill is that you can actually help people get on the right meds or change, like really figure out what they need,
Yeah. Well, you make very good points, and there are some real principles here. So for one, to me it seems as limiting to dismiss the pharmacological end of things as it would be to dismiss other ends.
Right.
Now, it's true that conventional psychiatry dismisses a lot of what we think of in integrative medicine or integrative psychiatry as valuable contributions to make. So there is more limiting within only practicing at the psychopharmacology end. Like, I do not call myself a psychopharmacologist. I can do the heck at a psychopharmacology.
Yeah, no, I know that, but
I
know
don't call myself
that,
right? Because that's limiting.
Right.
And I'll refer to myself as a psychiatrist or a physician or a healer or a shaman before I want to narrow myself just to the narrow direct biochemistry of psychiatry. But equally, even though it gets less attention, it is dismissive to say I'm only going to function at another end of the spectrum. Like, we're going to completely dismiss the medicines, for example. There's just too many grateful people walking around. Now, that's not to say that it couldn't be done better. And so I take a real pride in being able to have a very sound knowledge of psychopharmacology, but really also attend to it in ways that don't get adequately addressed in psychiatry. There's too much symptom-based psychiatry. Our research is on syndromes, on disease states, in the DSM sort of diagnostical statistical manual, the diagnostic statistical manual. So, but still, the research is on syndromes, not on symptoms. And you find too much throwing of medicines at symptoms. So, a fever. A fever could be caused by a virus, a bacteria, or cancer. Three very different origins. You said, we go toward the cause of your illness. Well, to treat a virus or a bacteria or cancer is three very different causes, even though the fever is the same thing. So if we just throw an anti-fever medicine at you just to bring down your temperature, we're not getting at the cause of the problem. Three very distinct causes. So anxiety is that. Confusion is that. Irritability is that. We cannot treat by symptoms. So conventional psychiatry does better when it treats syndromes, where we have the research, than when we pursue just symptoms. And we should really only go to symptom relief when we really can't understand or get at syndrome relief. So I take a pride in really focusing on the diagnostics involved in what is your syndrome. And then we can apply the variety of treatments, not just pharmaceuticals, but we have research for that, but the full spectrum of what we call integrative psychiatry, and which is a lot of common sense. But so that's one piece. So we want proper diagnostics.
Yes.
And there are brain scans and there's things, but to be honest, where psychiatry is now is still the interview. And we want to go through carefully to understand your experience, thoughts, behaviors, and feelings, so we can try to understand the syndrome. And not everybody fits so clearly into one little category or the other, which is really just familiarity. A lot of people complain of panic-like symptoms, so we call it panic for short. But not everybody fits so clearly into one basket or not. So we want to figure out, where do you fit in?
When you say we, you mean you. I want to figure
Oh,
it out.
we, all of us who
Collectively, all
want,
of us
right, who want the
integrative, yeah.
best for everybody.
Yes, yes.
But yes, when you come see me, we're certainly going to focus a lot on diagnostics, because diagnosis drives treatment.
Yes.
And that includes the holistic treatments.
Right.
Also, we need to be open, and you need to be willing to as a caregiver, to admit to fallibility. You need to be able to revisit the diagnostics. I thought we were going here, but maybe we're going there. So if you have too narrow of a vision, you lock into the diagnosis from day one, you miss out on opportunities to really understand the full experience that people
So
have.
the need to always be revisiting where you are.
Right, with a humility.
Yeah,
to
with humility.
To revisit where we are with a humility. And patients are much better about hearing, I don't know.
Yeah.
They're grateful for an honest I don't know than the misdirection.
Yeah. Or the digging in and just sticking with what you think and not.
Yeah.
So let me ask you a question, because people listening actually are probably very curious, like what you treat, right?
Well, I just want to say that
Yeah.
well, you're absolutely right. And so having an open, ongoing relationship that can evolve is critical here with the diagnostics. I tell patients all the time, you know more about you than I could ever know about you. I know more about the science of treating and the tradition of treating than you'll probably ever know, given that you don't study it as much as I do. But if either one of us alone is making the decisions, we're probably going to come up short. If we put our heads together, we're going to do best.
Right.
And that includes the diagnostics, and it also includes some attention in treatment that doesn't fully come up just in conventional psychiatry. This gets to your question ultimately about what I treat. Efficacy versus effectiveness. People use the words interchangeably, but they're really not the same thing. They're, when you spell things differently, they have different meanings. Efficacy and effectiveness. Efficacy, does it work in the test tube? So much of our research is based on...
That's the research term, right? Yeah.
Exactly. It's the research term. And it's nice to know what works in the test tube, but we're treating real people in the real world. So there's all other factors that come into play in going from the test tube to the real world. Factors we need to take into account that often are not taken into account by research and then the application of research to practice. And those are things like safety, or
side
ease
effects,
of dosing,
or...
and the biggest one, exactly, you beat me to the punchline,
Sorry.
is side effects. No, fine, because you think that way too,
Yeah.
which is fantastic. We have to create real treatments in the real world that real people can really do.
Right.
You can't just have a concept or take this even though it's so hard to tolerate. If you don't swallow the pill or the nutrient or the exercise, I guarantee it doesn't work.
Right.
So another part of what we do, even just in the pharmacology piece of a holistic practice, is a real attention to a treatment plan, a pharmaceutical component of a comprehensive treatment plan that real people can do in the real world.
Right, and checking in with your patient to make sure, is this something you can do?
Absolutely.
And being very, that's where the relationship comes in, and that's one of the things that I hear loud and clear with what you're saying, is that the relationship you have with your patients is so important, because you need that dialogue. They need to feel comfortable telling you what's happening and what's working and what's
Absolutely,
not. Yeah.
absolutely. Honesty is essential.
Yeah.
And the good thing is that the confidentiality is something we take seriously.
Yeah.
So it's an honesty in a safe space. You better edit in all of your relationships. You better think before you speak with your spouse and your boss and your child and everybody else. Don't edit when it comes to us.
Right.
Tell us what's going on. You're not going to be judged for it.
Right.
And the more we know, the more we can share, and the more we can help. Do not edit. Unscrew that skull and just let it come out, and we'll figure out what all those parts mean.
I love that. I'm going to use that. Unscrew that skull. So as we're sort of wrapping up our discussion, I think let's just do nuts and bolts, because I think people might be wondering, do you treat kids? Do you do all kinds of mental illness? Do you just do depression? Like, what do you? So give the scope of your practice, and I will say that one of my favorite things that you say is that for all these people you treat, is that right now a lot of you might be walking around feeling sort of just good enough, but Dr. Quentzel believes in optimal, right? That he wants to help you feel optimal. So, and not just good enough.
Yeah, good enough is not good
enough. Is not good enough. And so speak to the camera and tell people who should come see you.
Yeah, for one, I've been trained as a psychiatrist, boarded in specialty board in psychiatry. I've also trained as a family physician, so I have a real head-to-toe sense. I don't have a fellowship in child psychiatry, so I see kids, but those who are
adolescents.
Yeah, so from puberty onward, because in essence they're small adults, where children are a different chemistry. But I enjoy teenagers and
what do you treat
young
teenagers
adults.
For?
So, full spectrum of traditional or conventional psychiatry, as well as sort of beyond that. So we're talking about mood disorders, anxiety disorders, bipolar, unipolar depression, schizophrenia, other thought disorders that might be induced by medical problems or substance abuse. There's addiction. There's women's psychiatry, some things around pregnancy or PMS or menopause, various phases of women's life cycles.
So back to the teenagers, what about the ADD and sort of spectrum kind of kids?
Attention deficit disorder is a big piece of working with teenagers and working with young adults. It's something that tends to reduce over time, so it's skewed toward a younger population. The spectrum for autism also has its sort of unique features, and where you fall in that spectrum is going to determine a lot about what we can do. It's less it's asking for help in the holistic psychiatry realm,
right,
because there's so few answers in some ways from the conventional psychiatry realm.
Okay, so those are all your teenagers, right? And then in adults,
and with the teenagers, there's all these adjustment problems too.
Right.
We were made.
All I know is that there's so much anxiety in our community here. That's one of the reasons I'm so grateful. Like, all my patients, as I've been telling them that you're coming to join us, they're just so excited to bring their kids to see you.
Yeah, fantastic.
It's been very difficult.
We were made to react to acute stress, and so we have a great system. Saber-tooth tiger, I better fight or flight, right? I better run or go. But then my whole fight or flight system is going to turn down as soon as I'm done with that.
Right.
But we've taken that, we've selected for people who have the most reactive fight or flight systems. Those are the ones who survived over the many years. In fact, that's also part of our problem with so much inflammatory trouble. That's linked in, right? We get the people who are the most reactive immune systems, the most reactive inflammatory systems, the most reactive fight or flight systems, because back then it was trauma, you got eaten by a saber-toothed tiger,
right,
or infection, right, that got us. That's not what gets us now, not our first world problems. But we've now taken these systems, these biochemical systems that are really fine-tuned for dealing with acute stress, and we've now laid chronic stress on top of it. And we see all sorts of problems when we have a gross mismatch between the many ways that we experience chronic stress with a body and a brain and a gut and a nervous system and an immune system that was built for acute stress. Right. And we see the ramifications in so many ways across the board.
In terms of anxiety, especially.
And so we see it play out in terms of anxiety. Yeah. Stress is an outside force, anxiety is an internal response, and we see kids suffering more and more. As the chronic stressors are laid on us more and more, do more faster. I say all the time, reality beats the heck out of virtual reality. Yeah. We need to have our young people engaged in real relationship, not just in virtual relationship. There's all sorts of advantages, obviously, from an efficiency standpoint.
But then you also have families have to be engaged,
exactly, because
there's a lot of pressure that's put on the kids, especially in this community here.
Very few of the kids that we're going to see, generally speaking, have sort of innate pathophysiological problems. I mean, for every one bipolar, there's 100 or 1,000 adjustment issues, or really a psychodynamic formulation rather than a diagnostic statistical manual
So
formulation.
their environment. When you would
Right,
say that,
we
like,
say like 90% of child psychiatrists treat the parents.
Yeah, right.
But that also means the environment.
Right.
Treat, all of the impact.
Yeah, so coming for a second then to adults, because that was a really good sort of explanation about adolescence.
And so coming up with a treatment plan that addresses the forces impacting on young people,
Right.
and not just
including the family, including everything.
Yeah. And a way they can play an active role in affecting that.
Right.
And security, the nature of the bonds, which is goes back to a real psychodynamic kind of concept, still holds a great deal of weight.
Right.
To be able to walk securely in this world and reduce greatly the sense of anxiety that may plague you as a result of upbringing, of circumstance.
And then speaking of adults though, there's plenty of anxiety in
And
the
there's
adult
plenty of
population.
adults there,
I
too.
really feel that we have an epidemic of anxiety right now. I mean, I just see so many of it, and even like the word, even health anxiety, people who are just overwhelmed with being sick and sick of being tired and being afraid. There's so much fear about medical diagnoses and dying from cancer, and people walking around with a lot of anxiety. And I don't know if it's the times we live in or what, but it's really rough. But you know what, I want to keep us to our audience's attention here. And so as we wrap things up, let's shift to adults. And so what I want to tell everyone is that one of the really great opportunities here is whether or not you are already on medication. So this is for everyone, teens, adults, everybody. No matter what diagnosis you have, if you're already on medication, but you're not feeling like as well as you think you should, just good enough and not optimal, come and find out another way to look at what's going on for you. Dr. Quinzel can help you see make his own sort of judgment or recommendations about your medication, as well as create a holistic plan that can really help you feel better.
Correct.
Right?
A comprehensive plan, as I tell folks, always includes the four big prongs or legs. There's self-help and lifestyle. And we spend a lot of time on that. That's drawing on that, all those innate powers that you have to be able to help yourself. There's the psychotherapeutic interventions, the various forms of psychotherapies, not all of which is how do you feel about your mother kind of stuff. There's a broad sense of what psychotherapeutic intervention can mean, but it really is a magical, effective treatment. And then finally, there's biochemistry, or coming at it directly as opposed to the other avenues that come at it indirectly. And there's two main prongs of the fork. One is the natural treatments, and the other are the pharmaceutical treatments. Right. And we have to assess what the pros and the cons of both, and we come up with a treatment plan that makes sense. Sometimes it's mixing them, sometimes it's one, sometimes it's the other.
Okay.
But it's that full spectrum,
yes.
And it's for the full spectrum of material that normally falls in the psychiatric realm: mood problems, thought problems, behavior problems. But it's also what I do, where sort of you use the term psychosomatic, where body meets brain, or where mind meets brain, or so issues of pain, hormonal issues, sleep concerns, which all have a direct and important impact on brain, but also are in large part affected by what happens in central nervous system, or in spirit, or in emotion. And so it's a broader diagnostic spread for folks I see, but it's also a broader treatment plan for whatever we identify within that broader spectrum, diagnostic spectrum.
Got it.
How are we going to treat?
All right, good. And I do want to add though that so if you're already on medication, all that, but also if you just don't feel, if you have any kind of concerns about your mood, or you're just feeling blue, or you're not sure if you have any sort of issue, you're just not feeling well from a mental health perspective, and you're not on medication, or you're thinking maybe you need it, maybe a little anxious, maybe a little depressed, you're not really sure, this is a great place to start, because you can start with all those other options other than medication. And I always think that, especially if you're just feeling a little off, you know, that's the time when you can really turn this around and not end up needing medication. And of course, if they did need medication, that would be an option as well.
Yeah.
So whether you're on medication or not, this is definitely a terrific option for you. And we're here now at Blum Center. Dr. Quentzel is here every Wednesday. Please come join us. You have evening hours for those people who work. Thank you so much for sharing your wisdom with everybody today.
Pleasure.
And come see us. Thank you.